Medicare is not free, and if you're approaching retirement age or you're getting ready to start Medicare, you want to have an understanding of what it's going to cost you. Specifically today, I want to talk about the cost of Medicare Part B. That's all the care you get outside of the hospitals, doctors, labs, tests, etc. So a lot of you may be surprised that there is a cost to Medicare Part B. You saw that FICA tax coming out of your paycheck, but that goes to cover the premium of Medicare Part A. So with Medicare Part B, there's two sets of costs you have to understand. There are monthly premiums, and then there's cost sharing, which is deductibles, co-pays, and coinsurance. In this video specifically, I'm going to talk about number one, monthly premiums, and I will do a second video on the cost share. In 2024, Medicare Part B's monthly premium is $174.70. While most people do pay this $174.70, if you are a higher income earner, in other words, if you have an income over a certain threshold, then you may pay more than the standard $174.70 in something called an income-related monthly adjustment amount, also known as IRMA. Before the end of the video, I will move out of the way of the chart, but I do want to talk to you about it first. And also know you could always Google Medicare IRMA 2024 and find a chart. But in the meantime, how does this work? So what is the threshold that you have to be over in order to end up paying more? Well, first it's going to depend. Do you file your taxes single or do you file them joint married? When the Social Security Administration determines whether or not you're going to have an IRMA, they're going to look at your tax returns from 2 years prior. Now, I'm holding that chart in my hand, so that's why I'm going to be looking down. But if you are filing your taxes single and you make $103,000 or less, you're not going to pay anything more than the standard amount. If you're making $206,000 or less, then you also will not, and when you're filing joint, then you also will not pay more than the standard amount. But anything above that amount, even if it's by $1, means you're going to be assessed IRMA. So we can use one of the categories as an example. I'm not going to read through every single one of them because you will be bored if I do that. But let's choose this column right here, that category. So if you're making, as a single person, your modified adjusted gross income from your tax return 2 years prior, $129,000 up to $161,000, you're going to have IRMA of $349.40. If you file your taxes married jointly, and you're making $258,000 up to $322,000, you also will pay the $349.40. And it's important to know that if you're in this second column and it's a husband and wife and you're both eligible for Medicare, you're both going to pay that higher premium amount. When you do apply for Medicare Part B, you will get a letter from the Social Security Administration if you are somebody making income over that threshold. Now, if you remember, I said they look at your tax return from 2 years prior. A lot of people are like, well, wait, I'm retiring. I'm not making that same kind of income. Just know there's something called an IRMA appeal. There's 7 grounds for an appeal. One of them is work reduction. One of them is work stoppage. So just know that IRMA's reassessed every year. But again, in that year, you're retiring and you're not having that same kind of income. There is something you could try to do to get it lowered. Here's the chart without me blocking it.